Good afternoon, everyone. Welcome to the Oceanside Library's afternoon programming. Today's seminar on management is brought to you by Northwell Health Katz Institute for Women's Health and Assemblywoman Missy Miller's office. Please welcome Dr. Madeline Gittleman. Thank you.
Thank you so much, Debbie, and thank you all for attending this seminar. I hope that you will find it helpful. And as Debbie had mentioned, I welcome any and all questions. I will probably save them to the end, but certainly if something is pressing, you can type it into the chat or unmute yourself, and I'll try to best answer it. So I am Madeline Gittleman. I am a clinical psychologist, and I work in the Department of Neurology as part of Northwell Health. And I primarily work with patients who are dealing with chronic pain. So this was a very important talk for me and something that's very close to my heart and work that I do on a pretty daily basis. Um, Today, I would like to cover just a little discussion on the nature of chronic pain and how pain can affect so many areas of life, really all areas of a person's life, because it becomes so consuming and pervasive. And so, I want to talk a little bit about the complexity of pain and what that experience is like, where pain begins to affect aspects of our life, which then in turn might affect us emotionally and psychologically, which in turn can affect the pain. So you kind of find yourself in this cycle. And then I'd like to ideally leave you all, if you are yourself living with chronic pain or you have a loved one living with chronic pain, I'd like to go through some strategies that can be helpful in managing life with chronic pain. I wish this talk was on the cure for chronic pain. And if we ever find it, I promise I will do many, many talks on that. But for right now, where we're at is learning how to live with pain and manage pain the most effectively so that you can still have some quality of life. I know a lot of patients will say, well, is that really possible? If you lived in my shoes and you experienced the amount of pain I had, I don't think that you would suggest that it's possible. But it is. And sometimes it's by making little subtle changes, many, many subtle changes over time. Sometimes it's by making a big change in the way you think or the way you approach it. But yes, I have seen it happen in real time, and it is possible to improve your quality of life, even though pain is going to be a part of it. And so these are the different strategies that we'll try to touch upon. Certainly, we will not be able to go in depth into each one of these. Each one of these can probably have a talk in and of itself. So certainly, I don't know if Debbie provides my contact information, but I'm happy to provide that if anybody is looking for further resources or further places to get resources to delve a little bit more deeply into any one of these things, I'm happy to provide that. So, why does chronic pain create distress in both patients and clinicians? Um, if you are someone who lives with chronic pain, you may not have only experienced your own distress. But you may have had some negative experiences in talking to your doctors about this. Um, Doctors getting their backups, doctors saying, there's nothing I could do, kind of throwing their hands up in the air, seemingly helpless, seemingly frustrated with you. If you've lived with chronic pain for a long time, you might have had situations where a doctor refuses to prescribe a medication that had been helpful, or you get to the pharmacy and you feel like the pharmacist is judging you for having to be on a medication. And so, why? When we have so many medical conditions where this doesn't happen, why is pain something that creates this much distress, not only for the patient, but also seemingly for clinicians? And the reason that I can come to for this is because pain is so extremely complex. First of all, pain is entirely subjective. right? We don't have, unfortunately, an x-ray machine that can tell you, yes, your pain is a level 10. We don't have a way of seeing into a person's pain. And so we are completely, as clinicians, dependent on patients' ratings and discussions and expressions of their pain. And so pain is something that's completely subjective. And so automatically, that makes it much more complex because it's not concrete. The other thing, these two quotes I really love: pain is not a reliable indicator of tissue damage, and tissue damage is not a reliable indicator of pain. And the extent of damage and the extent of pain together do not refer well to the experience of disability. And the examples that I could give you that speak to these quotes. So, one is you can have two people come into the doctor who have both had MRIs, who have some kind of damage to the same level of their spine, the exact type of damage. Maybe it's a slip disc at the same level of their spine, right? And one person is reporting excruciating pain at a level of 10, can barely walk when they get in there. And the other person barely notice it and is shocked that they see that on an MRI, right? So it tells us that just the finding, right? If there is something that we can objectively see, it doesn't necessarily correlate with what the person's individual experience is like. And the other thing is, just like those two people might report very, very different things, you could have two people who report the same level of pain, right? We have two people who come in with similar injuries or similar conditions, and maybe they both consistently report that their pain's at about a level of 7. But one of those people is working full time and is involved with their family and exercises regularly, and the other one spends almost every day in bed. And so, to speak to that second point, that even when a person's experience of the pain is similar to another person's experience of the pain, their way of coping and what they do with that pain and how they choose to live their life might vary incredibly. So, because of all of this variation and variability and the subjective nature, I think it poses a lot of challenges, not only for the patient themselves, but for the providers in how to approach it and how to understand it. I love this slide because if you live with pain, I imagine you might have felt like this or feel like this, right? Which is um, not only the physical aspects of the pain, but this sense of helplessness. I can't stand it. Why is this happening to me? Is it real? Am I making this up? Is this something that I'm doing that brought this onto me? I can't do anything. I haven't been functioning. I'm not working. I'm useless. I'm not a fully functioning member of society. How come the doctors can't cure me? All of these thoughts that create a sense of helplessness and lead to fear, lead to depression, lead to anxiety, and then create a whole range of another set of suffering aside just from the physical aspects of suffering. Um, Another way of understanding chronic pain is through a metaphor. I can't take credit for it. A former colleague of mine used this metaphor, and I really loved it. And she said, developing chronic pain is kind of like if you were driving along in your car and you were in control of the wheel, you were in control of how fast you were going, what turns you make, where you went to, what your destination was. And you decide you're going to pull over at a rest stop, stretch your legs a little bit. You get back in the car, and there's a passenger in the car. It's a stranger. You have no idea who this person is. You've never seen them before. You don't know why they're in your car. You assume maybe they made a mistake. But then they look at you dead in the eye and say, I'm here to stay. And I think for many people, the experience they have in living with chronic pain kind of would echo what a person would experience in that situation. The first thing would be feeling terrified and maybe feeling angry and doing everything they can to try to get rid of it. And at a certain point, once you've tried everything and exhausted all of your resources and all of your effort to fight, you end up sometimes giving up and giving up the wheel, right? And saying, there's nothing I could do. I can't function like this. And you might let that passenger take a hold of the wheel and you might end up in the back seat feeling completely helpless. And I hope that that metaphor for any of you who've experience chronic pain, that it might resonate with you. But what I also like about this metaphor is it's a nice setup for what you can do in the way of learning to manage your chronic pain. That ideally, like I said before, in a world where maybe you could cure pain, the goal would be get the passenger the hell out of the car, right? But if that's not possible, then what I do with patients is to try to help them figure out how to reclaim the wheel. So that even if that passenger's there, and then instead of feeling helpless and like you have to surrender complete control, you might not love having the passenger there. It might make you in a bad mood sometimes. It might limit some of the things that you could do. But if you feel like you have the way to grab a hold of the wheel for the majority of the trip, then you're still ultimately dictating where you go, how fast you go. And I think that that is true with a number of strategies. Pain for many people grabs a hold of the wheel, it takes control of your life, but slowly you can start reclaiming that control. I spoke a little bit about this phenomenon, that kind of vicious cycle, in that first slide, and this is uh, an image that I think captures all the different things that pain can affect, and then all the different things that affect pain, right? So, and this kind of speaks to why we end up losing a hold of the wheel. And so, a person develops chronic pain, they stop doing as much because it hurts to do things. It hurts to exercise. It hurts when you go and play with your grandchildren. It hurts when you are making plans and you have to sit for a long time. So you stop making plans. You stop going to the gym. You stop being as engaged with the people in your life. Naturally, as you stop doing as much, and this can happen pretty quickly with inactivity, pretty quickly comes some deconditioning. So now the body is actually getting weaker. Right? The muscle tone decreases. And so now you might end up having some other physical issues. In addition, the less engaged you are, and we all saw this unfortunately this past year with COVID, the less engaged you are in the world, the less engaged you are with people, then comes into the equation isolation or depression or anxiety, a whole range of emotional distress. And as you experience that emotional distress, you might feel like, who am I? If I can't do this and I can't work, then who am I? So all of a sudden, you don't feel like you have a purpose or you don't really understand what your role is anymore. And then, boom, loss, lose control of that wheel. But the other side of this is how we regain it, right? So through self-management exercises and education, and beginning to approach things rather than avoid them, seeing more people, beginning to take baby steps towards incorporating exercise again, with an increased sense of activity, maybe sleep improves, and then emotionally you improve, and all of a sudden you start grabbing a hold of that wheel. So that's what we're going to go into, all of these steps in the upward spiral. So we know for those of you who experience pain, there are a range outside of behavioral approaches, which I'm going to focus on today. There are a number of other approaches that can help you grab a hold of that wheel outside of my field. And so I won't delve into them, but I'll just mention them because anybody who is new to chronic pain and maybe hasn't pursued formal pain management, I think it's important to know what's out there, in terms of what can be helpful to you. So, first and foremost, obviously, is medication. And we do know that a number of people respond really well to medication. Medication and opiates in particular have gotten a very bad reputation. And what I can say about that from being in pain management for some time and then having mentors who have been in it even longer is that, like with many things, we see with opiates and medication management of pain, there is this pendulum. And several years ago, around the 80s, the pendulum was swung in the direction of we had discovered how helpful opiates can be for pain management, and the doctors kind of went wild in prescribing them. And we were prescribing loads of them without precautions like evaluating risk factors and looking into history and history of substance abuse and looking into emotional history and psychiatric history. And so the doctors, were being very free in their prescription of these medications, and it helped a number of people. And having that easy access, I think there were some benefits of that. But what we have seen with the opiate epidemic is that without those cautionary measures in place, there were a number of people who ended up becoming addicted and ended up using it problematically and ended up having it really destroy their lives. Um, Once we noticed that, for better for worse, the pendulum swung all the way in the other direction. And we are still kind of in this place of demonizing opiates. And I don't love being in that place because opiates can be really helpful, and people who do not have risk factors can use them reliably and safely. And so to completely limit people's access to these drugs that can be very helpful is not really where we want to be. And so, what I think the hope is for people in the pain world is that after some time and now putting some of these cautionary measures into place, regular drug tests and screens, better measures to assess psychiatric functioning and risk factors, that we could end up settling back in a place and the pendulum could kind of fall somewhere in the middle where we are prescribing again and not demonizing it so much and not stigmatizing people who are on these medications, but we are being more cautious in how we prescribe. We do see, because of what had happened with opiates, one of the silver linings of that has been that there's been a lot of money and a lot of efforts put into finding non opiate medication approaches to pain management. Headache is an area where we've seen a real boom in various treatments that have been incredibly effective. So we are hoping that it's only a matter of time before we see a number of improvements and a number of other drugs come out there that can treat things like chronic back pain, chronic joint pain, chronic neuropathic pain. So we are hopeful, because we've seen it happen in certain areas of pain, that we will get there in terms of giving patients options other than opiates. And there are other options in terms of NSAIDs and anti-inflammatories, and various types of nerve oriented medications. And so, if you haven't approached this, then absolutely I encourage you seeking a pain consultation with a pain expert who's an expert in all the different medications that could be helpful to you. There are also interventions. So there are injections, epidurals, there are infusions, there are, in extreme cases, surgeries, and not only surgeries, let's say, to attempt to repair something, but there are also surgeries, for instance, spinal cord stimulator surgeries, where they actually implant a device that conducts an electrical impulse that can then decrease the experience of pain. So, surgery and interventions are also options. There's therapies other than psychotherapy, physical therapy. And occupational therapy, depending on where the chronic pain lies, can be incredibly effective in helping you begin to regain some of that conditioning. And to keep on moving despite the pain. And for a number of people, you'll see, I'll mention this, many of the doctors will recommend exercise, but a lot of my patients, at least, have been so inactive for so long that it feels scary and dangerous to just begin to exercise without any kind of formal input. So, physical therapy is kind of a nice stepping stone to developing your own exercise regimen where you get the feedback from the physical therapist in what's going to be safe, what level can I do this to, how much can I push myself, how much should I increase my functioning, or what goals should I set. So that's a nice stepping stone. And then there's another of complementary alternative treatments, yoga, massage, Reiki, aromatherapy. We know that there's certain scents that seem to help alleviate certain symptoms. Certainly, massage and various types of massage can be incredibly helpful. Acupuncture, which is something that can sometimes be done by the physician themselves or sometimes is done by a CAM treatment specialist, but we know that acupuncture can be incredibly helpful. And then there's some interventions that you can utilize on your own, ice baths, heat packs, um, uh, Let me think. Showers, cold showers, warm showers. So certainly, when it comes to pain, I always tell people, you know, try it. It doesn't hurt, especially with a lot of these complementary or alternative things. If it can help, why not do it? I will say that I've gotten some feedback from patients, and I share their frustration that one of the limiting factors in these complementary alternative modes is the cost. And at this point, unfortunately, insurance doesn't typically cover these types of treatments. My hope is that with more and more research showing that some of them can be very effective, we will see a change in that. But right now, all of those typically come out of pocket. And then the rest of the presentation, we'll talk about behavioral approaches, my wheelhouse. Um, when we start kind of thinking about what are the things that a person with pain can do to help themselves, one of the concepts that's really important to think about is where is that person? And I could, have you ask yourselves, where are you in this kind of metric? This concept of locus control is how do you understand the consequences of your behavior? Do you feel like you have some degree of control over the experiences you have in your life? Or are you somebody who feels like life has just kind of happened to you? Right. And, a whole range of things can contribute to where you are in the spectrum. And I would say the majority of us are kind of not necessarily at just one extreme, but, find ourselves somewhere in a little bit from one side or the other. Um, if you are in more of an internal locus of control person, you believe I control the consequences of my behavior. So I have some ability to control my experiences. This kind of mode of thinking bodes very well for behavioral approaches to managing pain because if you believe I could control my experiences, then you're going to naturally be much more motivated to engage in changing some of the behaviors to help yourself. On the flip side, in having an external locus of control, and maybe you've had been dealt a lousy hand and had a number of bad experiences, so it leaves you feeling like a victim and leaves you feeling like, man, life has just kind of happened to me. No matter what I do to try to get control, I just can't. Um, what sometimes happens for those patients is it's hard to get up the motivation to do the things that can really make a difference because it feels like, well, what's the point? If I can't control the consequences of my behavior, then why work on changing my behavior? Right? We say that patients with external locus of control often approach doctor's visits with the notion of, what are you going to do to help me? How are you going to make this better for me? Where a person with an internal locus of control might say, like, what can I do? Is there anything I can do to manage it? And as I said before, the majority of us fall somewhere in the middle where we might say, okay, I'm hoping that you might be able to do something that helps, but I recognize that I'm going to need to make some changes too. And so if you found yourself, when you asked yourself this question and now understand this concept in more of an external mode, the next slide is something that can help bring you to a little bit of a sense of, yes, maybe there's things that happen to me that were outside of my control, but I am open to the notion that I can end up having some control and my behavior can inform the consequences I experience. And what you can do to bring yourself there is shift from asking, instead of, how did I get the pain? Why did this happen to me? These things always happen to me, and how is this happening, to instead saying, okay, this is happening, how do I manage it? Shift away from that external to internal. Next one is, instead of what caused this, what made this happen, you can think about, okay, what factors might influence my pain? Are there triggers that I could identify that maybe I could work to avoid? Are there things that I'm doing, times of day that seem worse than others? Are there things that if I understand it better, I might be able to then get a little bit more control? And as I mentioned in the last slide, it's not what can the doctor do for me, although it's okay to want some help and information from your doctor. But we have seen that people who achieve the most success in their pain management are asking themselves, what can I do to improve my quality of life with this pain. So, what are the different behavioral approaches and what are the different things that you can do if you've gotten yourself to saying, okay, I'm a believer that I could grab a hold of the wheel and I could have some control over my experiences in life? What are the steps that you could take? So the first strategy is just education. Education alone is actually an intervention when it comes to pain. And one thing that's important to educate yourself about is the difference between acute versus chronic pain. And it's often not talked about. And I will say, if you have people in your life who don't seem to get it and they don't seem to empathize with you, it might be because they've never experienced chronic pain. So the only model that they're familiar with is acute pain, which is adaptive, right? Acute pain is when you get injured and when there's some indication that there's tissue damage, your body sends signals to you to do something about it so that you could protect yourself. And we know with acute pain, once that tissue damage is repaired and gets better, the pain goes away. Right? Perfect example. You put your hand on a stove, it burns, sends the signal, you pull your hand away, right? And then that burn is going to hurt for some time, which enables you to take care of it and be cautious about it, and then it heals and the pain goes away. Chronic pain is a flaw in that system. Chronic pain is not adaptive. The metaphor that I use to explain this, and you could explain this to your loved ones who don't necessarily understand what you're going through. And if you sometimes question yourself and think, am I making this up? And why am I struggling with this so much? This is a strategy in and of itself. Imagine I put the wrong kind of alarm. It should have been a smoke detector, a fire alarm. But imagine a fire alarm in a person's house. And imagine you're home and your fire alarm goes off and it signals, the fire department to come. And the fire department comes and they look around your house and no fire, no smoke. They investigate. They ask you, did you notice anything different? Nope. And they say, you know what? Maybe just a glitch in the system. Sorry, seems like everything's okay. They go on their way. 5 minutes later, alarm's ringing again. Fire department comes back. They look around, they say, we don't know why this keeps happening, but clearly there's nothing that we can do about it, right? Now the alarm is going almost constantly. They say, you know what, maybe change the batteries, take it out. No matter what you do, that alarm keeps going off. You try to change the batteries. You try to take the alarm off the wall. You try to, get a new alarm, but no matter what you do, that alarm goes off. And maybe it stops for a day, and then the next day it goes off for 3 weeks in a row. And you could imagine what that would be like to have that piercing sound just going and going and going in a way that doesn't seem to make sense, that doesn't seem to be an indicator of a problem, that nobody seems to be able to give you answers why. And you could imagine that it could be pretty crazy making. Maybe eventually you'd learn ways to adapt. Maybe you'd put a towel around the thing to muffle it a little bit, and you'd put earplugs, and your whole family would have to wear earplugs. But it would take a lot out of you and it would consume a lot of your life. So, that I think is a good example of how different acute versus chronic pain is. You also want to educate yourself about your pain specifically. I have so many patients that come in and I'll ask them to do a pain journal and they'll say like, "Are you crazy? I just want to not think about my pain. I thought you were going to give me strategies to distract myself. And now you're telling me I have to look at my pain and I have to journal about it." But you don't have to do it indefinitely and you don't have to, keep a constant journal. But if you've never done something like this, I would recommend it because every once in a while, we can really learn something about our pain that can give you some greater control. For instance, I mentioned before, there might be a time of day that the pain tends to get worse. It might be, I had a patient the other day, she's lived with pain for years. And I pointed out, I reflected to her, I noticed that you keep saying that the pain is always the worst at night when you lie down. So I said, what's your bed like? How are you lying down? And she said, well, I like a flat pillow. So I lay down, pretty horizontal. And so I said, I wonder because position can affect pain, particularly headaches. I said, I wonder what would happen if you put a wedge, and instead of being horizontal, you were at, a 45-degree incline. Let's see what happens. And all of a sudden, her pain didn't get cured. But now, instead of the nighttime being so significantly worse, the nighttime is about the same as the rest of the day, which for her feels incredibly relieving. Right. So, but if she hadn't journaled her pain and hadn't kind of been reflecting what her experience was to me, then we wouldn't have known that and been able to try that. It might be certain foods, it might be weather, it might be a collection of things, it might be, um, certain types of engagement and certain types of activities. So you want to try to understand your pain as much as possible. And then once you have an understanding, like I said, you don't have to do it indefinitely, but every once in a while, I would do a week of a journal just to see did anything shift. Maybe it's been a year and you haven't taken a journal and the nature of your pain has changed a little bit, and it's good to take inventory again. Um, I put in here research and moderation because I'm always a fan of people advocating for themselves and understanding. Listen, I'm telling you to journal your pain. So I certainly like you getting to know what the issues are. And I'm okay with people doing some research. If you've been diagnosed with neuropathic pain or you've been diagnosed with um, chronic low back pain or chronic daily migraine and you want to do some research, I'm okay with it. However, like anything, it is important to do it in moderation because the internet, while being very helpful and making things very accessible, is also dangerous because there's no filtration system and some of the information you get might be bogus. And at a certain point, once you take in too much information, it might be more harmful than helpful in terms of provoking anxiety. So you want to be aware to kind of limit how much you're doing. The next strategy that becomes really important after education is taking a little bit of an inventory of where is your life at? What does your day to day look like? That's one of the first questions that I ask patients when they come to see me. Tell me what a typical day is like. And if that day is primarily spent in bed, and it involves almost no interaction with other people, involves almost no engagement in purposeful activity, then we know what direction we have to go in. And once we establish what the baseline is, then the next strategy that can be really helpful in managing pain is getting back to a place where you're setting goals for yourself. Remember that spiral, right? And one of the things was kind of disengagement and moving away from activities. And when we do that, we stop setting goals for ourselves. We kind of give up, right? We say, like, well, what's the point? I have so many patients who say, I used to make plans every night or, twice a week. But what's the point? If half the time I'm going to have to cancel, then what's the point in making the plan? And I think we end up kind of feeling like that about goals in general. What's the point in setting a goal if I don't think I'm going to be able to achieve it because my pain doesn't enable me to? And so, um, either in therapy or if you are using this strategy on your own, what you can do is based on where your baseline is at, kind of ask yourself, what do I miss the most? What do I want to get back in my life? What might bring meaning? What might bring joy back into my life? And then you use specific steps to kind of lay out a plan for yourself. Um, there's a number of things. The big mistake that we often make when we're setting goals is we kind of set it too broadly and non specifically. So we say things like, I'm going to be more active. I'm going to be a better person. I'm going to be more connected. I'm going to be more social. It's great in theory, but in actuality, it doesn't have meaning because it's just too broad. So you can ask yourself those broad questions, but then you have to get specific. Okay, what does that mean to be more social? If I have not had any contact with a friend of mine in 6 months, then maybe a goal that I could set is to make one phone call a day for the next 2 weeks. And once I've achieved that, maybe I could increase to two phone calls, or I could do a phone call and an email. And then maybe I could stretch my goal to trying to set one plan for the next 2 weeks, right? So you lay out things in a very specific way, in a way that's measurable. You could actually ask yourself, did I do this or did I not? You want it to be realistic. If we set the goals in too lofty of a place, human nature is to say, forget it. There's no way I'm going to achieve it. And then you quit before you even attempt. Um, we want it to be eye centered. So, delegation can be a really helpful strategy when living with chronic pain. But for these goals, you want it to be something that doesn't depend too much on things outside of your control. So, you want to have the initial goals at least be dependent just on you. And you want it to be something that you want, which is why I say it's important to start with what's going to bring joy. What is something that I really want to have back in my life? Um, I give this goal. You want to decrease back spasms, and some of the steps that you might take that are very specific and eye centered and desirable would be you're going to stretch in the morning 3 times a week. You're going to stretch before bed 3 times a week, and you're going to massage your back. You got one of those massagers, and you're going to massage your back time per day. It might feel like just a drop in the bucket, but if you succeed in this goal, then you're going to feel really good and you're going to be more likely to set more and more goals for yourself. And all of a sudden, you're grabbing a hold of that wheel. Relaxation, which I could spend not only, one session, I could probably spend 10 sessions on. So, relaxation is an incredibly helpful strategy for living with chronic pain because chronic pain is stressful. And chronic pain, we believe, can actually cause a person to be in this chronic state of fight or flight. Our bodies are built to enter into this state that we call fight or flight, which is an autonomic arousal state to protect us. And so, if somebody was chasing us, our body is going to automatically kick into this fight or flight gear where our muscles are going to tense up, our blood flow is going to change, our heart rate is going to increase. We're going to sweat more so that our body can be as productive as possible so that we can escape that threat. Unfortunately, with chronic pain, the body is often perceiving a chronic threat. So you end up being chronically in a fight or flight phase. Fight or flight is adaptive if something is truly chasing you and helpful. But if you are chronically in that state, what we have learned is it could lead to various other problems. If your muscles are chronically tight, you're going to end up potentially being more likely to injure yourself and experience other pains. If your heart rate is constantly up, we know that that could cause cardiac issues. Have learned through research that it often will decrease the functionality of the immune system to be in this chronic state of fight or flight. So, to engage in relaxation is not only something that can help you cope with the stress that pain has created, but it can also actually serve a function physiologically to move you out of that chronic state of arousal. There's a number of different relaxation exercises out there. And I've been saying since I've been doing this talk during the pandemic, one of the silver linings of the pandemic is there have been a wealth of resources that have been made pretty readily available to people online in apps that engage you in this relaxation. We have a long way to go in terms of providing psychological services to the the population at large. But I think to try to make a dent in that, there have been a number of things put out there to make relaxation accessible. And so there's the Calm app, which actually during the pandemic, they had lots of commercials. If you've seen those, Calm and Headspace were the two big ones that actually really put a big effort forth this year. There's 1,000 other ones. But then, even if you don't want to download an app or you're not super tech savvy, if you were to Google relaxation exercises for pain, you will find a wealth of resources. And these are the different types of exercises. There's progressive muscle relaxation where you start up at your head and work your way down your whole body, tensing and then releasing the muscles to actually help your body feel the difference between the stress and the tension versus being relaxed. Autogenic training is kind of inducing sensations through imagery of heat and cold, which can sometimes be very alleviating for people with pain. There's various types of visual guided imagery. So I put this one scene, and this might be reflective of what would be calming for somebody, but you might visualize going to a very serene and calm place that induces that sense of relaxation. I actually also, with my patients, use imagery to shift the experience of the pain. So we do something called pain transformative imagery. where, and you could try this, even though we're not formally doing this one-on-one. This would probably be enough information for you to try it. You take a moment and you try to relax as much as possible, but then you hone in on your pain as if you had a camera in your mind and you were zooming in with the lens on your pain. Again, there might be a little bit of resistance to this, just like with pain journaling. The thought might be, I don't want to think about my pain or focus in on it. I want to move away. But for the sake of this exercise, you zoom in on the pain just for a short period of time so that you could observe it almost like a scientist. And you notice how you experience the pain, what the spread is, what the location, what the quality is. And once you get a real feel for it and you're tuned into it, you use imagery to create an image that kind of depicts your experience of the pain. So, for example, a lot of people with neuropathic pain will describe the pain as having kind of a fiery type quality. And so, or an electric type quality, right? So, the image that a number of my patients have said was it feels like wires, a ball of wires all tangled up with lots of shorts and sparking all over the place. And so you hold that image that represents your pain, and then you try to transform that image with your mind. So, for instance, my patient with the ball of wires, imagine the rubber coating of the wires almost melting so that the areas where it was shorted, the rubber is now coating it. So it's still this ball of wires, but we don't see the sparks. For patients that describe it like a burning, raging fire, they might imagine a wet blanket, a heavy blanket covering the flames and putting them out. So you can play with this. For those of you who are creative, artistic, it might be a modality that is particularly speaks to you. And again, the intent and the goal is not to rid yourself of the pain, but sometimes by using your mind, you could shift your experience. And then just by the nature of the pain changing a little, it feels relieving. So even if the pain stays at a level of 7, if it went from stabbing and sharp to dull and achy, that might feel relieving. There's all different types of breathing exercises that can help you get a hold of that heart rate, which can in turn help relax you. Mindfulness is a buzzword and something that we've heard a lot about. I think there's been a number of articles about mindfulness, especially in the last year. And essentially, that is just tuning into your experience in the here and now without judgment. We often are living in a place where we're either reflecting on the past and kind of filling ourselves with shoulda, coulda, wouldas, or we're thinking about the future and filling ourselves with what ifs, which both create distress. So, if we can learn to be more focused in the present moment and let go of the judgment, the criticism, that inner critic that often kind of comes into the picture, and just let ourselves kind of exist in our experience. Now, sometimes we can be mindful of a particular experience, like I might. To help patients learn this skill, I might give them a sucking candy and have them eat the sucking candy mindfully, noticing the flavor and the texture and the smell and how it feels as it moves around their mouth. And that gives them an example of what it feels like to be mindful of a specific action. But what the goal can also be is that you can eventually learn to be mindful of the pain itself, meaning you can learn, and it sounds kind of impossible, but it can happen to coexist with your pain and kind of instead of being in a place where you're saying like, "Ow, it hurts. What do I do? What do I do? I can't deal with this. I can't bear it. This is going to kill me. This is ruining my life. Why can't the doctors help me?" Not that you always live in that place, but a lot of times when the pain gets bad, that's what comes up for a person. And so if you could cultivate this ability to kind of observe the pain without judgment, then what that might look like is, wow, I feel a lot of discomfort in my lower back. And I notice it spreads kind of from the right side to the left side. And it feels kind of like it almost is in line with my pulse, like it's beating. And it kind of has this stabbing quality to it, but it sometimes seems to kind of wear off just a little bit. And I notice because it hurts lower in my spine, I feel some tension in my back. Now, this isn't pleasant, right? And it's not wonderful. But if you notice, if you stay in that place of observing and not running away from it, not chasing it, not um, judging it, then sometimes the stress stays lower, the anxiety stays lower, and then you have a greater capacity to cope with the pain. And hypnosis is something obviously that typically is done with an expert in hypnosis. I would recommend for anybody who is interested, it can be incredibly effective. But my one piece of advice is to really make sure that the person is certified and has had extensive training in hypnosis. Hypnosis is one of those things that a lot of people claim to be able to do, but to truly be certified in hypnosis requires a lot, extensive hours of training under supervision. And so I would encourage you to just check the credentials of who you would go to. There are some self hypnosis exercises that can be very helpful, and those are easily accessible in the other ways that the other exercises are. But if you are seeking hypnosis treatment, just make sure the person is credentialed correctly. Cognitive behavioral therapy is something that I do formally, and it's kind of the core of what I do. But it is the concepts of cognitive behavioral therapy are things that you can bring into your life even if you aren't engaged in psychotherapy. The tenets basically being that the way we feel, the way we think, and the way we behave are all interrelated, so that if we make a shift to one, in turn, the others are going to change. Now, as I mentioned, relaxation in the previous slide, that is a strategy that targets the emotional aspect of that, right? So we are trying to shift from that chronic state of stress and anxiety to entering into relaxation. We also, in terms of emotions, because things like depression are incredibly common for people with pain, we want to make sure we're also targeting that. And so many people say, of course I'm depressed, I have pain. And that might be the case, but that doesn't mean we shouldn't treat the depression. I have many patients who have seen psychiatrists and started antidepressants for the depression, and because the depression gets a little bit better, they're better able to cope with the pain, and therefore they're functioning better and experiencing a better quality of life. So we can target the emotions through the strategies I mentioned and also some outside strategies. Um, the behavioral category we talked about in terms of setting the goals and educating ourselves. That's ways that we can change behavior. And there's a couple other things that I'll mention in the last couple of slides. But the thoughts is one piece that we haven't mentioned too much of, and how we think about our pain and how we think about ourselves in relation to our pain is incredibly important in terms of our experience. I mentioned before that concept of locus of control, and certainly that speaks to how we think about ourselves in relationship to our life. And so you had a little bit of a window into how our thoughts can affect us. But what we see, also what I see, is such a range of thoughts. If you have two people and one person thinks, I'm never going to get better, nobody can understand my pain, people judge me, my doctor doesn't believe me, people think that I'm crazy, and that it's all in my head. Um, there's nothing that I could do to change my current situation. Versus a person who has almost identical pain but is saying, thinking to themselves, I hate living with pain, but I believe that there's things that I might be able to do to enhance my quality of life. That if I approach things in a really stepwise fashion, maybe I could be involved with friends again. Um, I My quality of life has really declined, but I can still preserve some quality. And maybe if I work on communicating more effectively, people can understand part of my experience. You can imagine that those two different people are going to have drastically different experiences. The first one likely is going to be dealing with depression and isolation, which in turn worsens their pain. The other person is going to have the physical aspect of it, but they're going to remain hopeful and probably more engaged and have more success in a lot of the strategies that we talked about. So, um, this is all well and good, but it's hard to notice the way we're thinking because thoughts just happen automatically. I always say when I was young, I remember I had these vocal nodules, and I went to a speech therapist who said, well, you speak wrong. And I said, like, what does that mean? Right? I mean, how I'm speaking wrong? And what she ended up having to do, because even though I could understand at an intellectual level what she was talking about, I didn't know what that meant. How do I catch myself in the act of speaking if it's so automatically? It would be like telling somebody they're walking wrong, right? And I remember she had to record me so that I could then hear it and reflect on it. So, similarly, our thoughts happen so automatically. So, to tune into the way we think, we have to often record our thoughts. And we do that through thought journaling. There are a few apps where you can do that, but I'm a big fan of old school paper and pen. And there's a lot of ways that you can just journal the thoughts you have. I encourage people, I say, use your emotions as a guide. If you're feeling hopeless, if you're feeling incredibly depressed, if you're feeling isolated, take a moment and ask yourself, what thoughts might be fueling this feeling? And as you start gaining a little bit more awareness of the different ways that you're thinking, you're going to catch yourself in some of these, what we call distortions, some of these kind of erroneous ways of thinking. That person who said, I'm never going to get better, nobody will understand me, right? I'm never going to get better is kind of a catastrophic thought and a future oriented thought. It's a big assumption. Right. And I understand why people get there. I understand how negative their experiences could have been that made them feel that way. But there's a difference between saying, I'm having the feeling that I'm not going to get better versus saying, absolutely, I'm not going to get better. There's magnifying and minimizing certain situations or all or nothing thinking. With exercise, I hear this a lot. I've had patients who are former athletes, right? And they'll say, like, I used to run marathons. If I can't run anymore, what's the point in exercising? That's a good example of all or nothing thinking, where if I can't do it to the extreme, then I'm not going to do it at all. Mind reading, nobody's going to understand me. How do we know that? We can't read people's minds. We don't know what other people are thinking. So once you start really paying attention to the way that you're thinking and catching yourself in some of these distortions, then the strategy is to challenge these distortions and come up with alternate, more realistic ways of thinking. Some of the ways that we can challenge our thoughts is we could say, if your best friend came up to you and was living with chronic pain and said, nobody will ever understand me, would you let your friend get away with that? Or would you challenge it? Would you say, listen, I might not know what you experience, but I could appreciate your suffering, right? So you wouldn't, if you wouldn't let a friend get away with it, then you can't let yourself get away with it. Sometimes I'll use the courtroom examine the evidence kind of strategy where I'll say, if a person says, I'm never going to work again, or I'm never going to be able to have any purpose, um, I will say, okay, well, let's look at the evidence. You are a parent and you are engaged in your children's lives. You're coming to sessions with me, right? That's purposeful activity. And so if you were in a court of law, your argument would not hold water, right? If a person's being very extreme, thinking in those black or white terms, you might say, okay, if running a marathon is at one end of this extreme and never going to the gym is at the other end of the extreme, what would be something that would fall somewhere in the middle? So you challenge yourself, and then ideally you come to more helpful ways of thinking. I hate this pain, but I think that with these strategies, I can improve my life. Maybe some people will never understand what I feel, but those who are closest to me, I think will try. Um, Maybe I won't be able to run a marathon again, but I could gradually increase my functioning and start building back my endurance. And once you shift that thinking, hope comes back into the picture, depression decreases, anxiety decreases. Behavior therapy, I know we're going to run out of time. With behavior, other than goal setting and educating yourself, another thing to think about is how you approach certain activities. And so the one I'll focus on the most is this concept of pacing, because I think this is what becomes the most relevant. There's so many things that people have given up altogether because doing it the way they had in the past is just not feasible. And so I think if you can shift the approach to the activity, then it often becomes something that's within reach. So, for example, if going back to that exercise example, that person, instead of trying to run a marathon again, if they say, okay, when I walk for more than 15 minutes, my pain starts shooting through the roof. What I would do is I'd start them on a program where I say, let's walk for 5 minutes so that you stay completely comfortable and then take a break. Take a break for 3 minutes, sit down, and then do another 5 minutes, sit down, and then maybe do another five, or maybe you just start with five and a break and five, so that instead of inducing the pain, you're still engaging in an activity and you're still building endurance, but you're being sensitive to your body and listening to your pain. And I always say it's like the tortoise and the hare. A lot of people resist this concept because they feel like, wait, when I feel good, I have a patient who says, on my good days, I need to be as productive as possible because I know on bad days, I might be followed by 2 weeks of being completely knocked out in bed. So on my good days, I have to clean my own house. I have to clean my whole house. I have to do 10 loads of laundry. And inevitably, what happens is because they push themselves that hard, they actually set themselves into a flare. And so she resisted at first, but what instead we worked on was doing a little bit each day instead of, even if it was a bad pain day, really shifting how she does things and doing just a little bit each day so that we don't induce that kind of problematic thing. Communication, I mentioned before, people often think they can't be understood either by the people in their lives and their families or their friends or even by their physicians. And so, kind of paying attention to how you communicate about your pain can be very helpful. It's important to be assertive. Sometimes we get so frustrated when you're living with pain that you end up becoming a little bit passive or passive aggressive or a little bit aggressive. God, you'll never understand my pain. You don't know what it's like to live with this. Um, or passive aggressive comments that come out, and so it can be very helpful to just practice being assertive, which is to come from the position of my feelings matter but so do yours, and kind of a helpful format to ensure that you're speaking assertively is to kind of say, I feel this when this happens, or I feel X when you do Y because of this. And so that can be really important in maintaining and sustaining your relationships. Um, while a lot of these strategies talk about how to increase activity and increase your functionality, it's also important to know when to say no. And sometimes, you push yourself beyond your limit and then you pay tenfold. So knowing when to say no becomes really important. With physicians, it's I encourage everybody, because pain is so complex and these interactions can become complex. Write down your thoughts, write down your questions. That's can make a world of difference between leaving the visit feeling like you've accomplished something versus feeling like, I don't know what just happened in that visit. And then, sometimes because we're living with chronic pain, we feel like a lot of people should cater to us. But it's important to remember, other people, even if they're not living with chronic pain, often have their own crosses to bear. And so it is important to remind yourself how helpful active listening can be so that you continue to be an active, engaged member in your family. And the last piece, I hope I've left enough time for questions, is just to think about healthy living strategies in general. These are the kinds of things that every single primary care doctor is going to tell you to do for your overall health and for your mental health, and they're right. And a lot of these things are things that fly out the window with pain. So I encourage you, if you're living with chronic pain and your sleep is lousy and you haven't been exercising and you haven't really paid attention to what you're consuming, start paying attention, because making little tweaks might make the difference in feeling like you're in the back seat and the passenger has the wheel versus feeling like you've gotten control again. Particularly for nutrition, there are some foods that are natural anti-inflammatories, leafy greens, certain berries. Certain fish can all be natural anti-inflammatory. There's lists that you could get off the web. And so you might want to aim for incorporating a lot of those foods. Um, Thinking about moderation is always going to be key, no matter what it is that you're consuming. Hydration becomes incredibly important with conditions like headache. Um, Exercise, I've given a lot of exercise examples, but I always tell patients walking can be exercise. I have so many patients who just say, I just can't do it. But I'll say to them, well, you walked into my office, right? You walked from the car to my office. So even if you start with walking for 4 minutes and you just gradually build, that's exercise and that counts. I mentioned the concept of pacing in the previous slide, and you want to always incorporate that to build exercise back. And with sleep, because again, that's another topic that we could spend a full session. Sleep is one of the things that pain often affects. I have a lot of patients that wake up because of their pain or because they're so anxious and stressed and depressed because of pain. They find that at nighttime, that's a time where they ruminate, and it's hard to get to sleep. Um, so there's a number of things that you can do to improve sleep. Sleep hygiene is just various behaviors that can improve sleep. Things like having your bedroom be a sacred place, um, only using the bed for sleeping and sex. A lot of patients with pain end up eating in their bed, watching TV in their bed, working from their bed. That messes with the sleep cycle, and it messes with the association our brain makes with sleep. So you want to break that habit, and really reserve the bed only for sleep. Um, you might think about whether you're napping. And I know for some people with pain, a nap becomes essential just to survive, and that's okay. But you want to think about how close are you napping to sleep? How long are you napping for? Because inevitably that's going to affect how well you sleep at night. Um, and again, any if anybody wants additional resources or suggestions in any of these areas, you could absolutely get in touch with me, and I have a wealth of resources in any one of these areas. I'll end with just a quote that I love, and this picture, which is where I hope patients are at the end of treatment with me, or if you're utilizing these strategies on your own. This is where I envision, in my fantasy, this is where patients are kind of behind the wheel with a little smirk, feeling like, yeah, I told that passenger. Um, the quote, the greatest revolution of our time is the knowledge that human beings, by changing the inner attitudes of their minds, can transform the outer aspects of their lives. So we can make change, even if it's just little step, by sometimes just shifting our thought or shifting an emotion we're experiencing or shifting a little behavior. So thank you so much, for listening. I can take questions. I know I'm a bit over time, so I don't know if Debbie, if you guys go right into another presentation or if there's time still for questions.
We have a few minutes. We can definitely take questions, but
Okay,
I will stop the recording at this
great.
point so that the
Sure.
questions aren't recorded.
Okay,
So
great.
give
And
me.
I am checking to see if I can see the chat. I don't know if I can. So